I'm gone away. I'm gone away. I'm gone away. And the sun gonna shine on a brand new day for me. A brand new day for love. Brand new day for me. Brand new day for love. Yeah, I'm motorboating. I'm gone away. I'm gone away. I'm gone away. Yeah. Then the sun gonna shine on a brand new day for me. A brand new day for love. Brand new day for me. Brand new day for love. Brand new day for me. Brand new day for love. Brand new day for me. Brand new day for love. Yeah.
Greetings once again. Today's business to talk about burns, assessments, management, and nursing care plans of those patients with burns. So I come again. So the first thing we are going to talk about burns. When we talk about burns are damage to the skin layers. Skin layers include, remember, we have three skin layers. We have skin is divided into three: epidermis, dermis, hypodermis. Hypodermis are also known as the subcutaneous tissues or subcutaneous layer of the skin. So someone when you get a burn, those layers are damaged, including there's a burn you can get where muscles and bones and the ligaments are affected. So we talk about it. So let's start. Burns are damaged to these layers. As I said, they are epidermis, dermis, hypodermis, and sometimes muscles and bone ligament may be involved. So burns are caused by, may be caused by chemicals. That is called a chemical burn. So chemicals include acids, bases. Acid which may cause you burn is the hydrochloric acid. So you may also get a burn caused by base. Other type of burn is called thermal burn. The other cause of burn is a burn caused by hot object. For example, a spilled hot milk on you or a spilled hot tea, it may cause you burn, or a hot object. So other is a radiation burn. Radiation burn because when you're exposed to the sun. When you're exposed to the sun, vitamin D is secreted to help you maintain the thermoregulation in your skin. So there is a burn you can get in those. There is enough in vitamin D produced and hence you are getting your skin is getting damaged more due to the lack of vitamin D. So apart from vitamin D, let us talk about for other is what we call sky burn, which is mostly common in children. Where also other is the apart from sky burn, we have what we call electrical burn. Regarding electrical burn is the burn due to the when you are being affected by electricity. It's burn caused by electricity, so this is very dangerous. Why we say that this electrical burn is very dangerous? Very dangerous because once you get a burn from electrical circuits or electrical current, your bones, your muscles may be affected, and once your muscles are affected, there is what we call myoglobin. Myoglobin is easily in the blood. Remember, for normal secretion, hemoglobin is easily in the blood. Even for other secretion, hemoglobin is in the blood because they carry oxygen and it makes blood radical. It gives blood a radical. So myoglobin, when combined with hemoglobin, it will go. Those blood will need to be filtered, and those blood will pass into the kidney. Once passed to the kidney will then the kidney will filter those blood. Remember, those blood contain myoglobin and hemoglobin. So when you're going to filter those blood, it may cause damage to the kidney, what they call acute kidney injury. In a small word, it is known as AKI, acute kidney injury. So for the acute kidney injury, once your kidney which filter blood and excrete waste is damaged, excretion of waste will decrease. Excretion of waste rate and glomerular filtration rate in the kidney will decrease, which may lead to renal failure after. So renal failure is when glomerulus are being affected and no longer cardiac function, and nephron will totally or halfly damaged, because nephron are the basic need for the kidney. So let's come back. Apart from the causes of the burn, we need first aid of the burn. Someone get a burn. What you need to know, if you are a nurse living in that home or a community work, what you need to know about. When you are a nurse, what you need to know about managing a burn, first aid for burn. Burn you need to use when someone get a burn, you need to rinse. You need to put running water, cool warm running water for at least 20 to 50 minutes for the site where burn occurred, and after applying those the next is to call an ambulance for an emergency. Someone is calling an ambulance for an emergency, and what you do is to manage that patient. And also, if to manage, remember to start for ABC, to check for ABC. A, start from airways, manage airways, because there are burns which require you to first manage if airways, breathing, circulation, and disability are still functioning well. So you may get a burn to the face, and you need to manage You need to know, is it airways still working properly or not? So you need to manage airways, breathing, circulation, disability, and then finally exposure, as we do for emergency cases. So after, you need to give to rehydrate the patient if a problem for rehydration. Then that is the first aid for that patient. So after patient goes to the hospital, what we need to know is, burns, the causes. You need to know manifest aid. You need to know the risk factors. What are risk factors for burn? Young people, children, at risk for developing burns due to compared to the adult ones. Young children, especially, they need sometimes develop what to call scared burns or electrical burns, especially infants, and those children who are under preschool age, that is the children below 6 to 12 years of age. So apart from the risk factors, what we need to know is what someone get burn, you need to treat, to manage those burns. But you manage a burn after knowing, is it the first degree, second degree, third degree, or fourth degree? If a classification of burns, we classify burns based on different things. For example, depths. For example, areas. Regarding areas, epidermis may be affected. Epidermis may be affected. Dermis may be affected. According to the depths. So we have what you call superficial burns. We have what you call partial thickness burns. We have what you call full thickness burns, and what you call deep full thickness burns. According to the degree of burns, we have first degree burn, second degree burn, third degree burn, and the fourth degree burn. Then let us talk about those burns. First degree burns, epidermis is only affected. Remember, the role of epidermis is to prevent the infection from occurring, so it protects your skin. The sign symptoms for someone with first degree burn is first thing is the pain, as the nerve ending are not yet damaged. The second is very the skin is red, and also there's no blisters and no scarrings. Blisters, what blisters is? So let's talk about it in the second degree burn. So the second degree burn is the degree burn which affect 2 layers of the skin. Second degree burn Second degree burn is when epidermis and the dermis are affected. So when they are affected, epidermis and dermis are affected, there is what we call blisters. Blisters is the fluid accumulation in the space between epidermis and dermis. So during the healing, once there is a healing, a scar is formed, may be formed between epidermis, apart from the layers between epidermis and dermis. So during the second degree burn, there are blisters. The color is very red, and also you might feel pain. The other is the third degree burn. The third degree burn, 3 layers of the skin are affected. Remember, the third degree burn is also called superficial burns. Second is called partial thickness, and the third is called full thickness. So in the third degree burn, epidermis is affected, dermis is affected, and the hypodermis is affected. Remember, the role of dermis is to contain blood vessels. So when blood vessels are being damaged, there is immunosuppression. So we have a third degree burn. Third degree burn, when it has made to no pain. It is painless, as the nerve endings are damaged. So once those nerve endings which are contained in the subcutaneous layer, remember, hypodermis is also called subcutaneous layer. Once they are damaged, you feel no pain. So there's other one, the last one, which is fourth degree burn, where epidermis, dermis, hypodermis, muscles, bones, and ligaments are affected. For example, if you get an electrical burn, it may complicate our body, leading to cardiac arrhythmias. So you need to monitor. If you are a nurse, working at emergency, if you see a person with electrical burn, you need to monitor cardiac system. There is cardiac monitoring, so as to monitor if the patient does get cardiac problems like cardiac arrhythmias. So it needs to be monitored. So bones also are also affected. For example, someone who is hospitalized and has a bone fracture, bone maybe who is not doing movement, bones, calcium may be absorbed in the bone, leading to hypercalcemia. So you need to monitor for the symptom of hypercalcemia if the patient being hospitalized is not mobilizing or doing locomotions, moving from one place to another, or changing positions. So that is it. So what do you know? What you need to know about burn management? So burn management has 3 phases. Apart from talking about burn management, let us first talk about inhalation injuries, because inhalation injuries is the most emergency injury you need to focus on while someone is having burns. For example, someone may have burns on eyes, on face, on nose. So what you need to look as a nurse, you need to think first. You need to think of inhalation problems. So you need to monitor, you need to measure pulse, you need to measure pulse, you need to measure oxygen, you need to measure arrhythmia, you need to measure respiratory rate. So in summary, you need to monitor for respiratory, for gas exchange and the airway clearance. As the patient may have an effective airway clearance and impaired gas exchange, so need to focus on that. So let's and also it may have circumferential bands on the chest. When someone has circumferential band, I mean the patient, the chest, you need to monitor for. You need to listen to lung sound, so to check if no crackles and wheezing, which may indicate the fluid overload. And fluid overload we need to rhinophalia in the hands, also may lead to heart failure. And hence some patient may die, so need to be aware of that. So apart, there is what we call burn management. What happens if someone is burned? If someone has a burn, regarding burn management, if someone has burn, what happens? There's a shift from intravascular space of fluid to the interstitial space. So plasma shift from intravascular space to the interstitial space. If fluid shift, then there is a response to the brain saying the heart, you need to pump, you need to work hard. So heart rate increase, you need to work hard to pump more blood. The blood is being decreased. So after that, the heart pump. I work hard to pump blood, but it hasn't enough blood, so this leads to food volume deficit. That is why for the stage of burn, for the first stage, we have a free stage of burn, emergent, acute, and the free stage of burn management. We have emergent, acute, and the repetitive burn management. For emergent burn management, what we need to restore is capillary permeability, as it has been increased. So to restore volume, so the patient not to be at risk of hypovolemic shock. For the acute phase, we do dressing, so we crush the wound and prevent infection. And for the final stage, which is the repetitive phase, what we do is to promote the wound healing by encouraging the patient to eat high nutrient clothing proteins. So to manage burns, we need to know the total body surface area burned and the fluid to give to the patient. To determine the total body surface area burned, we use rule of 9. For the adults, for the adult, that is the people of aged above 10 years. For those below 10 years, we use round in the Browder chart. So that the Parkland formula also applies for pediatrics. We use 3 milliliter of fluid. For adults, we use 4 milliliter of fluid. So regarding the rule of 9, which is the most used to assess the burn, to evaluate the total surface area burned, we start from head, eyes, the face is equal to 4.5 and the posterior is equal to 45 and the total is equal to 9. Regarding the arm, anterior of the arm of the right arm is 4.5 and the anterior of the posterior of it is 45, so it is 9. So both arms is equal to 18. Chest, thorax or chest is equal to 9. Regarding anterior chest is equal to 9, or anterior trunk is anterior chest is equal to 9 and anterior abdomen is equal to 9. So anterior trunk is equal to 18 and the posterior trunk is equal to 18. So the total trunk is equal to 56. So perineum or genital area is equal to 1. Then for legs we have upper and lower. For upper right leg is 4.5. Then upper lower right leg is 4.5, which is equal to 9. So anterior of the right leg is equal to 9 and the posterior is equal to 9, so it is equal to 18 and the other leg is equal to 18. So the total O is equal to 100%. So what Parkland formula is? Parkland formula is the formula used. It was the rule of 9 was developed with the Wallace and Parkland balance set. So the Parkland formula is used to determine the food replacement to give it to the patient. The most common food given in a poor patient with burn is the ringer lactate or Hartmann solution. So how Parkland formula is calculated. To calculate the Parkland formula, you take 4 milliliter times total body surface area of burn, total surface area burned times weight in kilogram. If we are given weight in RFCs divided by 2.22, so you need to calculate that in kilogram. So weight for pediatrician, we take 3 milliliter times weight in kilogram, that is the weight of the child, times the total body surface area burned. The fluid volume you get is going to be given in the first 24 hours. But in those first 24 hours, we need to give fluid. You need to give fluid, half of the fluid, the volume of the milliliter of fluid you get in 8 hours, first 8 hours, and the other in 16 hours. So suppose you have, let's do it back on the formula. Suppose you get percentage burned is 40, total body surface burned times 4, which is equal to 160 times weight. Suppose weight is 2, then you get 3,200 milliliter to be given 24 hours, and you change a half of weight is 1,600 to be given in 8 hours and the other 16 hours. That is how to use Parkland's formula. But when in pediatrics it changes. Instead of multiplying weight, total body surface area times weight in kilogram by 4, multiply it by 3. So thanks for your friends for attention. That's all we have to talk about burns management. If you want any topic or suggestion, you can see us.